Hello, my name is Sarah France and I work for Unison Northwest. On behalf of the staff side here at the Trust, I just want to take a few minutes of your time to tell you about the trade unions here at the Trust. So what is a trade union? A trade union is a group of employees who join together to maintain and improve their conditions of employment. Trade unions aim to protect their members. This includes making sure that workplaces are safe and that their employees' health is not being put at risk through their jobs. Trade unions collectively negotiate better pay and conditions on behalf of their members. If, for example, a single member of staff approaches an employer asking them for a pay rise, they are much less likely to be successful than if every member of staff speaks as one through their trade union. So what do trade unions do? Well, trade unions speak on behalf of their members. They provide members with information, advice and guidance about work-related problems. They represent you and support you in meetings you may have with your manager. Trade unions provide members with a range of services, including training and education. Trade unions campaign on issues that are important to their members. For example, low pay, discrimination and bullying. Sometimes during our work, things don't go as we expect. You might get sick or you might make a mistake, and that needs to be investigated. Union reps are fully trained in representation and employment law. They work alongside you, and so they understand what you are going through. They understand your employer's policies and procedures, so they're more qualified to help you. Unions operate differently, but most of the NHS trade unions have local union reps. Some larger unions have teams of union reps at your trust, so you might have a union branch in your health trust. To find out who your local reps are, you can look on your trust intranet or find out where the union office is and call and speak to your rep. Unions campaign on issues that are important to their members. The last few months have shone a light on the essential contribution that all NHS workers make. Unions are therefore calling upon the government to give all NHS staff a meaningful pay rise and recognise the true value of their work. Union members have campaigned, negotiated and achieved things for years. The terms and conditions and pay that you now have. Fair pay, safe staffing levels, annual leave allowance, pensions, sick pay, overtime rates, all have been negotiated by trade unions. Public services have been hit by hard times with funding, but now the unions campaign to protect the things that we've campaigned and negotiated for years. Unions campaign on issues that are important to their members. The last few months have shone a light on the essential There are many issues facing healthcare workers during the COVID-19 pandemic, and trade unions have been challenging the government and employers to ensure staff have the correct PPE and access to COVID testing. Where it's been necessary, we have raised issues with the quality of PPE provided. We have supported NHS staff who are shielding or who are clinically vulnerable to enable them to work from home or work in different areas to ensure that they are not put at any unnecessary risk. Some unions have a professional service unit that represent and advise members if they face allegations about their fitness to practice or if they are having problems applying for or renewing their registration. Some trade unions offer this as part of their membership. Professional indemnity is an insurance offered to members who work in the health and social care profession. Also, for example, as part of Unison's indemnity insurance, we offer a Good Samaritan's clause. This means that if you were to administer first aid outside of your workplace, a Unison insurance indemnity also covers you should a person attempt to make a claim against you. Trade unions also offer their members with legal services. Each trade union has different services, and some offer legal services to the family of members at no extra cost. Most unions give free employment advice, representation on personal injury, at and away from work, road traffic accident injuries, access to immigration advice, industrial disease or illness, and criminal law representation. Some unions also give 30 minutes free telephone advice, free will writing services, and more. Unions also have additional membership benefits. Benefits vary from union to union, but mostly include member-only special deals on things like insurance, holidays, savings, car breakdown services, and many, many more things, saving members their hard-earned cash. Unions also give free education and training and support to their members. Most unions have helplines which are open to members to get free advice. Some unions also give money off professional publications. So how much does it cost? Well, subscription costs vary from union to union, and you should see the application form or the trade union website for more information. Some unions have flat rates for all members, whilst other unions have sliding scales of membership subscriptions, so that the less you earn, the less you pay. Some unions provide cheaper subscriptions to students and those staff working part-time, as subscriptions are based on what you earn. So whilst you're working for the NHS, make sure you join a trade union. You can do this by filling in an application form or going to the trade union website and joining online. So whilst you're working for the NHS, make sure you join a trade union. You can do this by filling in an application form or going to the trade union website and joining online.